So NHS Near Me is all about delivering care as close as possible to the patient. So we created NHS Near Me in response to patient feedback. So patients told us that they were fed up with having to travel long distances for outpatient appointments. So the aim of this service is to move the care as close as possible to the patient. So NHS Near Me involves a number of different things. It could be a telephone appointment, it could be a video appointment at home, it could be a video appointment at a local NHS facility such as a local hospital. So there will always be some times when patients need to travel. For example, a consultant may need to carry out a procedure or they may need access to some sort of specialist equipment. However, if we can reduce the travel for other types of appointments, then patients can get their care as close to home as possible. The first patient appointments will be very early in 2018. We are currently setting up 2 new NHS Near Me Telehealth rooms in Caithness General, and these are rooms that patients can come into the hospital and have their appointment there. And we wanted to test with one service first of all to make sure that we've got the whole process in place properly, and then very quickly after that we will start to add in additional clinical services. We'll also think about spreading the service in other ways as well. So I've talked about Caithness General, and we focused on Caithness because the patient feedback we'd had come from Caithness initially, but this is a problem that affects the whole of Highland, so we will be looking at other areas as well and looking at creating these NHS Near Me facilities across the patch.
We've been working in video conferencing for many years in the health service, and we've been using the technology for meetings, for sessions between clinical sites, but it's always eluded us the ability to actually provide a really good experience for someone in their own home. So around about 18 months ago, we randomly met a colleague called Chris Ryan from Health Direct Australia and Attend Anywhere. And what they've done is they've used this type of technology to provide drop-in services and clinical services in Australia. So we took the opportunity to learn and to realise that we could actually bring this to Scotland. So we're the first people outside Australia to use this system. And what it does for us is that it means that someone can sit in their home, in their car, on an oil rig, and simply use a web browser to actually have a clinical consultation with either a doctor, a nurse, a physiotherapist, whoever.
5 years ago I started working on a program with Health Direct Australia, which is the NHS 24 equivalent, and they're very focused on consumer access to health services, so access to information and advice via innovative technologies, which was the telephone for a very long time, nurse triage, after hours GP, pregnancy, birth and baby counselling. I was asked to add video to those services. So we embarked upon a road of enabling consumers to do this from their homes, and we have developed a management platform and experience around how to operationally integrate video as a normal, everyday, business as usual part of clinical services.
We started about a year ago, and that was when the service was launched, and in February 2017 we saw our first patient with a rash, and that avoided them having to take a plane from Shetland down to Aberdeen to have their rash looked at. Since then the services have just grown almost exponentially. We're doing respiratory clinics in the Western Isles, specialist nurse support for MND patients, psychiatry, the list goes on and on. So it's fantastic to see so many disciplines actually realise that this is a way that you can bring your patient and clinician closer together without the need for travel.
People just think it's about time, why can't we do this via Skype is a common refrain these days for people that have had to take an afternoon off work for a 15-minute appointment. So I think it's overdue from the consumer's perspective, and it's literally just pressing a button on a website. You do need a webcam, you do need some internet, but if you have both those things, it's one button. You walk into a waiting area, you get some reassuring music, messages on the screen, and then the clinician comes and joins you.
Patients will still receive appointments in the way that they do now. They can use their own computer with a webcam, they can use a smartphone or a tablet, as long as it is internet connected. And they're happy to use their own equipment, and that will put them into a virtual waiting room, which the consultant at the other end will see them arriving in the virtual waiting room, and will then link to them, and it will then be a face-to-face video consultation in the same way as you might have a FaceTime or a Skype conversation with someone. If the patient opts to have an appointment at a local NHS facility instead, say for example they haven't got the bandwidth connection at home or they haven't got a computer and they want to be supported through the consultation, then they can come to our new NHS Near Me Telehealth clinic, and they'll have a staff member just to turn it on, make sure it's all working properly for them, and will then leave so that the patient can have that confidential discussion with their consultant.
Certainly the feedback we have from patients is that they're really keen to use it, and one of the clinicians there in Grampian, his next clinic has got more video consulting patients than face-to-face patients.
So we've done some really early testing of this, and what we've found from patient feedback is what a difference it makes to patients. So for example, patients have said things like not having to travel at all, being able to have an appointment from their own home means they haven't got to take the car out in icy weather, they haven't got to get public transport, they haven't got to arrange for someone to look after their children because they've got a long journey. They can have somebody with them in an appointment, so maybe a family member who couldn't take a whole day off work to go with them to an appointment in Regmoor, but could actually take half an hour off in order to sit with them through an appointment. And this isn't us guessing that's what will happen, this is what patients have told us in our early testing of this software. So we're really excited about the difference it can make to patients, because that's what they've told us they want.